live in a country where we have a great healthcare system. You know, we have one of the longest life expectancies in the world. Access to healthcare is fantastic. But like many other developed countries, we're facing changes in terms of the way that healthcare needs to be delivered. We have a healthcare system that was largely built to treat acute health issues, but is increasingly faced with an ageing population and better treatment of acute diseases, which is leading to a larger demand in terms of chronic dementia, etc.
Well, I think health innovation is probably one platform, one theme that connects pretty much every market in the world. Everyone is figuring out how do I provide, every government, every system is united on better health for more people.
The other point, I guess, you know, this idea about consumer-driven changes and consumers, you know, social media, using avatars to ask questions, consumers demanding more information and using that to drive care. I guess, you know, Gus, maybe if you want to lead off on this, how much do you think the consumer will start to drive changes in the way that healthcare is delivered?
Let me paint utopia, and I think utopia is about 10 years away. Doctors will become and be seen to be as any other professional is that you employ, and you will do what the customer is asking you to do. I actually believe that in 10 years' time we will see total customer-driven healthcare. It's all about filling the gap in knowledge, choice, and what if. It's the unknown, but it's the choices that they want now. They really want to know what the alternatives are, best for them, best for their family, best for their children. It's all changed, and people are going to drive this, and we're going to drive it ourselves by purchasing, assisting, acquiring, joint venturing, whatever it is we need to do to fulfil patient-centred care.
I totally agree with Gus. I think, you know, it's not good enough for doctors to just give advice, take a piece of the body out, the tumour out, and then, you know, the patients spend maybe 2 or 3 days in hospital these days, and then they're dumped back home without support or knowledge. You know, the window's getting smaller and smaller, and unfortunately, still many health administrators think the hospital is the centre of the universe, and it's not. You know, most healthcare occurs in the community, and therefore it's important that we put end-to-end systems in place to make that work.
In terms of the electronic health record, it is we're at the start of a process. If Angus's dream is to be realised, where in 5 years' time there is consumer control of their own health, which is putting phraseology around his wordings, but a much better ownership, then one of the core tools of that must be in terms of the capacity of people to be able to have knowledge about their own health services and to be able to influence where they go and how they do it, and linkages between the various health providers, which we don't have now. 60% of Australians think our health system is linked. It is not linked. And so one of the major problems we have, notwithstanding John's comment, we really have an excellent health system. One of the major problems we have is a lack of linkage, particularly between GPs and specialists in particular, between the public sector and the private sector, and critically between that which is Commonwealth funded and that which is state funded, i.e. the hospital system and the primary care system. So the aim of the electronic health record, other than the elements of personal control, is to enable those linkages to occur, that people will have far more influence and knowledge around their own health status and the capacity to influence it.